Hello, I'm Sharon with Nurse Tim, and I'd like to thank you for joining us for our webinar, Next Gen Cases Made Easy, featuring Karen Sherrill. We will have technical assistance available at 866-861-2896, option 1, or help at nursetim.com. Handouts are available to download for our live viewers in your login email and for archive viewers on the right side of your screen. Please note, handouts are for personal use only and are not to be distributed to others. On the Zoom toolbar, you'll find the Q&A pod usable by our live attendees. At the end of our webinar, we look forward to a discussion with your questions in the Q&A pod. Our archive listeners are encouraged to drop us an email or give us a call. We also value your input as to desired topics for future webinars. ANCC disclosures. NCPD. This webinar has been awarded One Contact, One Nursing Continuing Professional Development Contact Hour by NurseTim Incorporated. NurseTim Inc. is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Centers Commission on Accreditation. Successful completion. Criteria for judging successful completion of the webinar are attendance at the entire activity and submission of a completed evaluation. Expiration date. Archived activities must be completed and evaluations submitted within 30 days of accessing from the NurseTim Inc. website. For more information, contact help at nursetim.com. Learning outcomes. 1. Differentiate between traditional and next-gen item types. 2. Discuss how to build a 6-question next-gen case using a formalized structure. 3. Create several next-gen cases using a mirrored item approach. Throughout this activity, the speaker may use a variety of real and varied resources from health education vendors. They're for illustrative purposes and are not to endorse any product. All images and references to the NCSBN Next Generation NCLEX are the property of the National Council State Boards of Nursing and provided for teaching purposes only. And now I'm so pleased to introduce our speaker. Karen Sherrill is an experienced nurse educator with over 3 decades of teaching in associate degree and baccalaureate nursing programs. Her experiences, passions, and areas of expertise are broad. They include clinical judgment integration, next-gen NCLEX item development, active and scrambled classrooms, student success and remediation, pre-licensure testing, and simulation pedagogy. Karen has led several innovative projects in college, statewide, and national organizations to advance teaching and learning in nursing education. Karen enjoys serving on the board of directors for Haiti Kids School, which supports children's education in Leogane, Haiti. In her retirement, she enjoys traveling internationally and getting out of the hot Phoenix weather and escaping to the mountains of Montana. We're so thrilled to have you with us today, Karen.
Thank you so much, Sharon, for that very warm welcome, and welcome to all of our guests, whether you're listening live or listening via archive. We're thrilled to have you here. If you've been with us on this marathon journey of our 4-pack testing webinars today, happy to say that this is the last of the 4 in the series. I hope that you have found a lot of value and insight and appreciated the time with us today. We certainly appreciated having you with us. So let's just go ahead and get started. This last webinar of the series that we're presenting is a little bit of a twist. You know, we talked initially today about blueprinting and setting up exams so that you can create a fair and equitable test for your students. We also, in our second webinar, talked about writing items and looking at how to take low-level items and turn those into high-level items, and talked about some shortcuts and ways in which to make that happen. Then in our third webinar of this series, we looked at item analysis and how to break down both content validity and item analysis in order to make that a very simplistic, practical approach to how to improve your exams and improve your student outcomes. So a little bit of a twist on this last webinar for today, where we're going to focus on next-gen cases. And I really have to preface this by saying, and of course, you know, as you all know, depending on where we're at in the timeline of life, you know, for those of us that are here live today. We are anticipating Next Gen right around the corner in just a few months. If you're listening by archive, you might be hearing and already experiencing Next Gen, and you're seeing our future. And so you have a different perspective of what we're presenting here today. But what I really want to emphasize and that we need to think about is that life is not all about Next Gen. There is no question that the Next Gen, as it rolls out in 2023, is going to have an impact on our students and possibly an impact on our board pass rates. But the reality is approximately 17 to 25% of our exam is going to be Next Gen in the new NCLEX world. But that leaves a very high percentage of items that are not Next Gen, which means that if you're only watching this webinar on Next Gen Cases Made Easy, I encourage you to go back to our other webinars that are a part of this series, because it is equally, if not more important, that we perfect the test items that we currently have so that we know our students are prepared not only for Next Gen, but are prepared for high-level application analysis level items that they're going to be getting on traditional NCLEX. So just some food for thought as you're moving forward and progressing in this trajectory. So what do we currently know? And like I said a second ago, this particular, what the vision that you're seeing, this PowerPoint slide, the table in front of you, is varied somewhat depending on the point in time that you're viewing this. But the left-hand column, I should say the second to the furthest left column, the one that says NCLEX today, that's where we're at between now and the time of April 1st of 23. But what I want to focus more on is the right two columns within this table and looking at where our students lie from the minimum length exam to the maximum length exam, taking the Next Gen style test. So both of those, as we know, the NCLEX is computer adaptive, and that means that the item that a student gets on the exam is dependent upon their previous performance. So if they're performing well, they're going to get harder questions. If they're performing poorly or miss some items, then they're going to start getting easier questions. And of course, this is not different than what we have done previously. If you want more information on computer adaptive testing, I encourage you to go to National Council State Boards of Nursing websites. They have some great tutorials that explain the process and how it is that computer adaptive testing functions and works. But because it's computer adaptive, there are students that are going to get a minimum length of exam, and there are students that are going to go the full length of the exam, and it can be anywhere in between those two. So for a student who receives minimum length Next Gen exam, they are going to have the 5 hours to complete it. They are going to get a minimum of 3 cases within their exam, their NCLEX exam. Each of those cases contains 6 questions. So that will be 18 items of scored case study questions that every student will get. Now they may get 2 or more unscored Next Gen cases as well. Those are going to be the pilot questions at this point in time. There may be a time in the future that the Next Gen cases expand and contains more than 3 scored, but initially this is how the exam is rolling out. So a student may get 3 to 5 cases, which is equivalent to 18 to 30 items that are Next Gen in style, knowing that of those 3 to 5 cases, at this point in time, only 3 of them will be scored. The student taking minimum length exam will get 52 additional items that are current style of NCLEX items. So they may get some multiple choice, they may get some drag and drop or hotspots, they may get the common styles that we're currently seeing on the NCLEX exam. Every student will have 15 unscored items. So those 15 unscored items might be a part of a case, or they might be freestanding, standalone, non-clinical judgment items. But regardless, the minimum number of items is transitioning to 85 questions, 15 of which are pilot items. Those individual Next Gen cases, the items within the Next Gen case are not computer adaptive, but the entire case is computer adaptive. So the initial case a student gets may be fairly simple. If they do well, the next case they get is going to be more complex. So the case as a whole is going to be computer adaptive, but the individual items within it are not going to be computer adaptive. Flip that then to the student who's going to be getting the full-length exam. And this student is going to get the same 5 hours. They'll get 3 scored cases. They may get an additional 2 or so additional pilot cases. And they're going to have 110 of the current style standalone items that National Council offers. But what they're going to be getting is approximately 7, or there's National Council saying 10%. So if a student, their minimum test shuts off at 85 items, but this student has to go to say 95 items. That means that approximately of those 10 additional items they're getting, approximately 1 of those is going to be a standalone next-gen style item. And then the standalone items right now are considered bow tie and trend. I'm not going to talk a lot about those during this webinar. We're mostly going to be focusing on the cases. But it just gives you a comparison about what's going to be happening with that test. So what are the traditional, what are the next gen? You're probably familiar with our traditional items: multiple choice, multiple response, which is the same as a select all that apply, fill in the blank, which are currently math items, drag and drop or rank order, hotspot items, chart exhibit, graphic, audio. Current scoring of these traditional items is all or none. Either you get it correct or you get it incorrect. You get a point or you don't get a point. As we migrate to next gen, we're also going to have next gen style items that are multiple choice, multiple response, drag and drop, drop down, highlight, and those are all going to fall within the case items of 6 questions. The standalone items are going to include bow tie and trend, like what I mentioned. And there's 3 different types of scoring, and it's going to vary based upon the item type. So some next-gen items are going to be scored at a 0-1 scoring, which is like what we have now. Either you get it right or you don't. You get a point or you don't get a point. Some types of items are going to be the plus-minus scoring. So that means you get a point for the correct answer and you lose a point for the incorrect answers. Select all that apply are going to be a plus-minus scoring. So students can get a point if they get it correct, lose a point if they get it incorrect, but students will never get a negative score. National Council has also said that traditional items, select all that apply, are going to go to plus-minus scoring in the new next-gen format exam. There is also scoring based upon rationale, which means there's 2 portions of a sentence that the student needs to complete correctly in order to get the point. So if they get 1 word correct and the second word incorrect, they will not get a point. They have to get both of them correct in order to get that point. So here's our first polling question, and I'd really love to know from the audience, how many next-gen cases have you built? And answer choices, we've got none, or I've tried unsuccessfully, less than 3, or more than 3. Go ahead and take a second to fill that in. If you're listening via archive, reflect on that, see how your answers compare to those that are in the live audience today. So Sharon, go ahead and show us the tallies on those. And great, this is awesome. I see that there's still a fair number that have not ventured out yet, but actually what thrilled me is to see that a decent portion, almost half of you, have actually, more than half of you, have at least attempted this process. So congratulations, everybody. Reach up with your right hand, pat yourself on the back. You deserve kudos for that. Now my thought is I'm going to just ask you out there, for those that have written even a single next-gen case, type into the Q&A for me real quick. I am curious to know, how has that process gone for you? Has it been painful? Has it been not so bad? Has it been extremely time-consuming? Give me 2 or 3 words that explain your process of writing a next-gen item and how that has gone for you. I see painful and rough, time-consuming, challenging, Time consuming, takes a long time. There's definitely a theme here. Time consuming and exhausting, time consuming, but I like them. Wonderful, Liz. Write more, write more. Very time consuming. There's definitely a theme here. There's no doubt about it. And Beth highlighted that she did it as a group in a workshop. And isn't that a great way to write these when you have the support of your colleagues to get through this time consuming, painful, grueling process, as everybody is saying in the Q&A section. Thank you, Dr. Havilah. I'm probably not pronouncing your name correctly, but the doctor states it gets quicker with each one, and I'd like to commend you for that. I'm going to give you a thumbs up for that one. Definitely gets easier with more practice. So for those that haven't written yet, you're like, okay, great. So this webinar is not going to do it for me. I guess I'm going to have to work at this, and the reality is we are. But I'm going to show you some great shortcuts at the end of the session. So what are the various styles that NextGen has demonstrated to us? Well, they have 5 main item styles that fall within the cases: multiple choice, multiple response, drag and drop, drop down and highlight. And with each of those 5 categories, there are several styles found within that. So when we're talking about a multiple choice, their style is a matrix multiple choice. That means there's only going to be one answer in each row. Multiple response comes in several different formats. Select all that apply, which we're familiar with. Select N, which tells you specifically how many answers to choose out of those up to 10 options. There's multiple response grouping questions, and I'll show you an example of one of those shortly. There's matrix multiple response. Drag and drop can be a close item. It can be one with rationale. Drop down, lots of options and styles. Highlight text, highlight table. So despite the fact that there's only 5 main types, you can see that there's a lot of different styles of items that our students may be exposed to when they take this test. And again, those standalone items right now are just the 2 different style types, the bow tie and the trends. The trends items, so that you know, that can be any of these item style types listed. So a trend item has EHR, where a student would navigate through an electronic health record and then answer a question that could be any of these style types that you see presented here. So here's an example of a multiple choice matrix item, and you can recognize a matrix because it has a table appearance on that right-hand side. If you haven't seen it before, this is what the exam will look similar to when our students look at it. They will have on the left-hand side of the page an electronic health record that they can navigate through, and they will see it unfold as more information is being exposed to them. That EHR will continue to be in their observation window throughout these 6 cases of the NextGen style items. So they can backtrack and go back to previously read information in that EHR and go through it a second time if they need to. On the right-hand side is where the question is going to be. And this particular question is a multiple choice matrix, and that means that they have several different options here. I'm seeing 3, 6, 8 different options, and the student is going to select either it should be included or it should not be included. But they're only going to be asked one of those 2 answer choices. They can't pick them both. They can't pick neither. They've got to pick one or the other. So they're going to have to highlight one of those radio buttons for each of these line items within this multiple choice matrix question. This example here is a multiple response matrix, and how it's different is that they can choose more than one answer within each row. So the students will be able to recognize these because rather than having a radio button, they're going to have a square box. And a square box tells them they can select one or more answer in each row. So if you look at each of these medications and were to navigate through this EHR, you could in fact select white blood cells, temperature, liver function test, platelets. You could select 2 of those, 3 of those, or all 4 of those as answer choices. This is a select N example, and this particular question it's a static question with a twist. So select all apply question, like we're traditionally used to and have been painfully using for years and years. But with the new NextGen, the static questions can be up to 10 answer responses. But when I have a select N, the exam is going to tell me how many correct answers to choose. So in this case, I may choose only 2. I cannot choose 1, and I cannot choose 3 or more. I can only select 2 correct answers for this particular style of item. This example that we have here is what's called a grouping question. So a grouping question has several questions within it, and a student will select 1 or more answers within each group. So if you look at this particular question, and this one has images with it, they're going to identify which statements best explains the nurse's feedback. They're going to select to highlight the correct answer in each group. So you'll see that there's an image and there's a series of answer choices, and then another image and a different series of answer choices. And this one, in fact, goes on to a third group where students would select 1 or more answers within that grouping. So this is called a select N or multiple response grouping item. When you look at a close item, a close basically means that the student is going to be completing a sentence. And there's a couple different ways that close items will be presented. One of them is using a drop-down option, similar to what you see here on the screen. The other style of close will be where they're actually doing a drag and drop. So they click on the answer within a table and they drag it up to where it needs to be within that sentence. So a closed question may have a single box that the student needs to answer, or they may have more than one box where a student will have to fill in the answer. Highlight text items are going to be where a student will take a chunk of information. Maybe it's in this example, it's a client statement, but it could be a nursing report, or it could be a lab record, or it could be a doctor's order list. And students will have to answer the question by clicking on the text that provides the answer to that question. It will highlight on their screen so they know that it is the correct answer. Sometimes it's a single highlight, sometimes it'll be multiple highlights, just depending on the item style. This is an example of the bow tie. If you have not seen those before, it is really basically a drag and drop, but there's going to be 3 different components where a student is going to have to provide answers. Most commonly, a condition is in the center column. Within that bow tie, they have to determine what is the abnormal condition. They might have to determine, what it is that tells them that, and they might have to tell, on the right-hand side, they might have to identify how they're going to evaluate or what they are going to anticipate, just depending on how the question is worded. Bow tie items are standalone only. They are not going to be a part of the cases, 6-question cases. So now we are at polling question number 2, and I'm asking which NextGen style item looks like the most fun to write. So I'll give you a second to answer that question. All right, Sharon, let's see what the outcome is. Where's the fun in this? Let's see what everybody thinks. Bow tie, I am right there with you. They can be extremely fun and they can be extremely frustrating, like all of these, but it's different anyway. And you know what? It's got a cute name, and there's something for having a cute name, So I agree with you. But here's one of the things that you might consider, because testing NextGen is one thing, but we need to be teaching NextGen, and our students need to be prepared for this. And one of the things that I like to do in my class, especially with bow tie, but you could do it with all different item style types, is I'll have students create their own. So I will give them a template to work from after we've talked about whatever content area we're covering for today. And I'll put them into groups and I'll say, okay, everybody build a bow tie question. And I'll have them sit down, work in small groups, present their bow tie, hand it to the next group, and that next group can then take that question. So you can do like a round robin, and you can do that with any of the style items. Have students create a highlight, have students create a clothes, drag down, drop down, or drag and drop or drop down type of clothes item. Have them create these questions in class and practice them on each other. And that way they are really having to work hard at thinking about, okay, what does this patient look like? Build that EHR, have them come up with those answers. Teach students how to take these style of items so they'll be prepared when it's their time to test with these types of items. So let's now go into the real meat of why we're here today. And that is, how do I build a case? And more importantly, how can I make that process easier? Well, I like to think about the process and compare it to building a house. You know, you can't build the roof first. You've got to start at the foundation. And the foundation when you're building a case, in my mind, the first floor, the very most important piece, is identifying your student outcomes. We need to make sure that every test question that we write and our students have to take on a test is connected to a student outcome, a learning outcome, a course objective, something. It needs to be based upon the curriculum. If a test item is not based upon the course curriculum, it's not a fair test item. Students can grieve the process. So before you begin your case, think about, what am I trying to achieve? What are the expectations that I have? After we've established this, I can move to the second floor, and at this point, I'm going to start building my client. Think about what components of that EHR need to be in place in order for students to decipher information, think critically, apply clinical judgment so they're able to answer these more complex questions. Third floor, I'm going to apply clinical judgment, and that very final step is actually building the items. I think many times faculty start at building the items, but they haven't created a sound foundation first, and it really makes it very challenging. So that first floor, like I said, we want to connect it to a course or unit objective. We want to identify, what's our concept, what's our exemplar, what is it we're wanting to identify within this case? And we want to make sure it's appropriately leveled to our student group, making sure that there's not extraneous information in there that our students don't have a baseline knowledge for. Make sure that that case we're building is fair for our students. So now the second floor, I need to start building my client. And oftentimes I will see faculty try to start with a blank piece of paper to build a client. I don't encourage that, because what you want to do is start with something you've already got. It'll make the process much easier. The very first case that I built was based upon a case study I was already using in my class. I had a case study I'd been using in class for years. I liked it. I had perfected it, and I simply took that case study, turned it into an electronic health record, added a few more bits and pieces, but that's how I built my first patient. That's a great starting point because it's content you're very familiar with. Think about personal experiences. And when I say personal experiences, I mean things that you've experienced in your personal life. So for example, my older son had appendicitis at the age of 6. I've written a case on that. My mom had a stroke in her late 70s. I've written a case on that. My dad had Parkinson's disease. I've written a case on that. Those personal experiences, you have that backstory. You can create that person pretty easily because you were so invested and passionate at the time you took care of that family member. Think about clinical experiences, and there are clinical experiences that you have lived through, but there's also clinical experiences that your students are living through. So think about, if you are in the process of collecting care maps or care plans or concept maps on your clinical students, you're collecting information and you've got a patient and it is HIPAA protected and it's sitting right in front of you. So as you retrieve that paperwork, clinical paperwork from your students, think of that as a clinical case that you can build. Most of the time, those have on it demographics, health history, medications, labs, diagnostic tests. It's got everything that you need in order to build a clinical case. Textbook cases, another wonderful resource. Think about your simulation cases that you could pull directly out of your sim products, and you could build those into cases. EHRs, most of the time, are already there. They're sitting right in your department. You've paid for those simulation cases, or somebody has built them for you. Turn those into next-gen patients. Or think about that patient. You know, we always had, oh my gosh, that patient. Do you remember when we took care of that patient? We have those stories. We have them in our mind. So turn those into your next-gen cases. So what do I want to do with the third floor? The third floor is where I'm going to apply my clinical judgment, and I'm going to design the question that I'm going to be asking. Now, the place that I always go to for this are these cue cards that have been provided to us by National Council of State Boards of Nursing. And as part of your handouts today, you will find those within the webinar package. These are available through their newsletter of winter of 2019. National Council says you are welcome to use them, you just cannot sell them. But what they've provided to us with these cards is lots of great questions that pose perfectly into next-gen questions. So for example, and if you've got a smaller screen, you might not be able to see this. I encourage you to print off the handouts that were provided. But for example, recognize cues. The questions posed there are, what information is relevant or irrelevant? What information is most important? What is of immediate concern? Any of these three questions turn into a next-gen case very easily. So if I want to design a case around recognized cues, I've developed my patient in the EHR. Now I simply say what information is relevant to the care of this patient, and I put in a next-gen case, and there it is. It's ready to go. So use these cue cards, use them however you need to in order to build that case. I got to tell you, on a side note, in my mind, these are the best things National Council's provided to us. You know, I started using these in my classroom 2 or 3 years ago, and I use them as a teaching strategy as well to support clinical judgment in every activity that I do in the classroom. So I have these made into posters. I have them on the walls in my classroom. I have laminated these before, sent them home with students. I make sure all of my clinical instructors have a pack of these in their pocket so they can go to clinical and they can be quizzing my students on each of the 6 steps of the clinical judgment measurement model. They are so valuable in developing a habit of thinking and applying clinical judgment in an ongoing fashion with your students. So take advantage of them. They're free to use. Send them off to your campus copy center and put them everywhere. Put them on the back of the doors in the bathroom stalls, wherever you need to, just put them out there. All right, so what is that final piece? We need to finish off the roof. And with that finishing of the roof, what we're going to be doing is looking at the different item style types. And we've already gone through several of those. I'm simply going to select the one that I want to use to finish off the roof as I develop this clinical case. So let's go ahead and we're going to build our first case here together. The first case I came up with is I wanted to pull my objective, of course. I need to put that foundation, that first floor out there, and that is to identify my course outcome. So my course outcome is going to be for a second semester student, and the course outcome reads, apply problem-solving strategies while providing care for adult students experiencing fluid imbalance. Very generic, typical course outcome. My concept within my course is fluid and electrolytes, and my exemplar is acute kidney injury. Okay, I've got a foundation, I've got a strategy, I've got a starting point for developing this clinical case. Now what I'm going to do, because I like to take shortcuts, I'm simply going to pull out one of the case study books I have on my shelf that I use with my students, and I am going to build a next-gen case out of this particular patient. This patient comes out of the NurseThink Conceptual Cases, Chapter 8 on homeostasis, case number 2, and now I'm going to build out a case for my friend Alfredo Hernandez. So, Alfredo Hernandez, and this is directly from the case study, this is what they provide to us, says that Alfredo Hernandez is a 38-year-old male who lives in southern Texas. He and his family migrated to the United States from Guatemala a few years ago and live together in a small house. His primary language is Spanish, but he has acquired the ability to understand and speak some English in his 3 years here. Like his mother, father, sisters, and cousins, he has type 2 diabetes. His diabetes is poorly controlled, and he is now insulin dependent. He has hypertension, decreased vision, and his feet are often cold and numb. His family brings him to the community hospital today because he's having a hard time breathing. So as I unfold this case that I have in front of me, I now need to think about what would Alfredo's electronic health record look like? What would be some key pieces of information that I could migrate into an EHR? Well, I'd want to have a banner page that's going to have some of my demographics on it. I could include a nurse's note or medical history. I could have glucose flow sheets, A1C, some labs, MAR, vital sign trends, physical assessment, lots of parts and pieces I can extrapolate from this little snippet of case history for this patient. So I start to build out my EHR, but as I'm doing that, I don't want to create an EHR that is exhaustive. I want it to only have snippets of information because remember, the goal of a next-gen case is for students to start at the beginning of recognizing and analyzing cues. I cannot give them all the answers. I simply want them to start thinking about what could be happening and how they're going to handle it. So as I created this EHR banner for Alfredo, the information there is pretty generic, but I did implant a cue. So look at this banner for just a second and see if you can identify a cue that has been implanted into the banner that could impact nursing care. Type it into the Q&A when you find it. Who sees a cue? Just in the banner. There we go. Vonnie, you got it. Absolutely. You're first one to nail it. So the BMI is hidden into the banner, isn't it? That BMI of 39 plays an important piece to my care of Hernandez or Alfredo Hernandez because he's obviously obese, and that's going to impact the care we deliver. Now what I've done is I've written a nursing note, but again, I haven't included all of this information that's in my case study, but simply what brought him in. I want my nurse's note to be spelled out in nursing talk. You know, this nursing notes don't come out as perfect, edited, grammarly checked sentences. They come out in nurse talk, and nurses don't speak normal English. So I'm going to write my nurse's note that is going to provide my students with some role modeling as to how to write a narrative note. And that's a skill set that many of our students don't have. So we want to role model that for them. My nursing note says, brought to the emergency department by family after experiencing difficulty breathing over the last 24 hours. Primary language is Spanish, interpreter requested. Okay, so think about that ED nurse as they're taking Alfredo in, getting him onto the gurney. What are the basic chief complaints? This is basically a triage note. Now I'm also going to give him a set of vital signs in hopes that my students will start analyzing that information and thinking about what could be going on with Alfredo that's causing this shortness of breath. Keeping in mind, they don't have a lot of this background information from my case. They just have this EHR snippet that's going to help them to think forward about how do I need to plan and provide my care. Now that I have created my EHR, what I want to do is go now to my cue cards and I want to identify what the question is going to be. So my first question is going to have to do with recognizing cues. So I could ask something that has to do with information being relevant or irrelevant or information that's most important. And when I get to my question that looks at analyzing cues, I might think about what client conditions are consistent with the cues and are there cues that support or contraindicate a particular condition. I can select any of those off of that. But for the sake of this example, what I've opted to do for my roof, where I start building the question, is I'm going to do a highlight question, and I'm going to do a highlight question that focuses on recognizing cues. The question to my next gen item is, after reviewing the client information, select the findings that are most concerning, okay, that met the needs of my cue card. I put it into this, the highlight style item. I'm simply going to have students highlight the information, and I've just highlighted it within that EHR on the screen so you can see where the correct answers are. So there, question number 1 is done. Now I need to migrate to question number 2, which I want to have be analyze cues, okay? And in this situation, I've chosen to use a grid matrix, okay? And this is going to be a single response grid matrix, so it's a multiple choice grid matrix that is going to analyze cues. So to analyze cues, I went to my cue card that says analyze cues, and I selected a question that says, after reviewing the client information, determine the cue, if the cue is relevant or irrelevant to the admitting symptoms. And I now have my grid where my students are going to select either relevant or irrelevant for each of those findings listed. I will go ahead and give you the answers because I know how you are. You're just like students. I know how it goes. And here's the thing, and I sometimes get some controversy with this particular question because people feel that some of this other information is relevant, but keep in mind that my question asks what is relevant or irrelevant to the admitting symptoms, okay? Is my blood glucose relevant? Sure. Is it relevant to the admitting symptoms of difficulty breathing? The answer is no. So next gen questions, just like our current questions, students have to read, okay? So what do I need to do next? Well, now I need to think about the next 2 steps of my case. I need to come up with the next 2 items of my 6-question case, focusing on prioritize hypothesis and generating solutions. And I have to ask, do I have enough information in this EHR to start prioritizing hypothesis and generating solutions? And if you think about that for a second, because what was my initial outcome going to be but acute kidney injury? Okay, so if this next step is going to ask students to explain what's most and least likely, do I have enough information to ask that question? And I would think that you're probably saying, well, no, not really. This case so far could be a million different situations and not kidney. So therefore, I need to add some more information to my EHR. So what am I going to add? Well, I'm going to go ahead and add additional nursing notes, and I'm going to add some lab results. So let me click back one. Thought maybe I could make that drop down go away, but it didn't. So what did I add within my nursing note? Well, I made another entry 10 minutes later and added more information. States through the interpreter that shortness of breath has slowly increased over the last 2 to 3 days, but worse over the last 24 hours. Unable to lay flat to sleep, can only breathe when upright. Hands and feet are swollen and had difficult time getting his shoes on to come in today. Crackles bilaterally, positive JVD, 3+ edema in all extremities, head of bed elevated, O2 at 2 liters nasal cannula. Still doesn't scream kidney disease, but it shows fluid imbalance for sure. So I am also going to add some labs. And within those labs, I have an elevated BUN and an elevated creatinine. So now I have enough information to ask my question and ask the students to start to prioritize their hypothesis. So in this case, I decided to use a closed dropdown, which means the student will complete a sentence, drop down to the options within this table. Client is experiencing blank as evidenced by blank, and students would select the options listed in the table below. So the correct answers are clients experiencing kidney failure as evidenced by BUN and creatinine level. Next, I need to go to what's my next step of the clinical judgment measurement model. What comes after prioritize hypothesis? Generate solutions. So this time I've opted to come up with some solutions of what I need to be doing rather than creating a whole new EHR. I've got enough information there. So I'm going to ask this question using the extended multiple response. This particular one is a select N multiple response because after reviewing the client information, select each solution that will achieve the desired outcome for this client, select 6 answers. And students can go through each of these answer choices, select 6 of them that are going to give them the correct answers. I know how you guys are about test questions. I'll give you a second to come up with the answers. See if you can come up with them. Sometimes people ask about timing. National Council is finding it's taking students a little over 1 minute to complete each question within the case on the average. So there are the correct answers for you. Hopefully you got those correct. And of course, we need to go to the next 2 steps, the last 2 steps of the clinical judgment measurement model, which is take action and evaluate outcome. And I have to go back to my EHR and ask, do I have enough information to take action? Do I have enough information to evaluate outcomes? And the answer is no, I don't. I need like some doctor's orders. I need something here that guide me into what actions I need to be taking. So let's add another piece to our EHR, but this time I've got 4 doctor's orders, doctor's prescriptions, including O2 and placing an IV, giving some diuretic and a chest x-ray. So this time I'm choosing to use a grid matrix question. And again, we identify those because it has a table format. It's take action is what I'm measuring of the clinical judgment measurement model. So I'm going to ask my students, after reviewing the client information, determine the sequence that the nurse should perform each action. And I love these questions because it really forces students to prioritize. What are you going to do first, second, third, and fourth? So students would need to fill in, of these 4 provider orders, in what order am I going to provide them to my students? So again, I'll give you just a couple seconds to think about your answers. And here are the correct answers. Everybody's patting themselves on the back, giving yourself a high five. Nice job. Well done, guys. Awesome. So the last piece, I need to evaluate outcomes. And for this one, the type of item I chose is an extended multiple response, not the select N, but the traditional extended, knowing that National Council was saying 8 to 10 answer choices are what are going to be on these, and this is going to be one that would be a plus minus scoring. So in order to answer this, the student would have to compare this particular question to previous information in the EHR. So you can see how navigating back and forth between the left side of the screen and the right side of the screen is going to be very important for students as they migrate through this process. I will give you the correct answers, 1, 2, 6, and 8. Hopefully you got those correct. So there, whew, that was it. How easy is that? Everybody was saying they're time consuming. My gosh, that didn't take any time at all, right? We did that in about 20 minutes. So the process is still painful, okay? So let me show you, this is my great theory. Feel free to take my quote, write it down, share it with friends. Learn how to work smarter, not harder. And it's a quote from me because I just said it and put it on the screen, but it's yours now. take it. Live with it. But let's figure out, what are the shortcuts? How do we make this process easier? Well, let's go back to Alfredo Hernandez. And he was brought to the emergency department by family after experiencing difficulty breathing, and he speaks Spanish. I want to ask in the Q&A, what type of patient besides acute kidney injury could this be? What other patient scenarios could we use? And I'm opening up the Q&A now. Heart failure, perfect. Diabetic, excellent. CHF, COPD, beautiful. How about COVID? Right? How about for those PE, asthma, pneumonia? Great. Let me hear from my pediatric people. How could we use this in a pediatric case? Do kids ever present with these symptoms? Certainly they can have asthma, they can have pneumonia, they can have croup, RSV, anaphylactic reaction. Excellent. How about my OB people? Tell me some examples. Does a laboring mother ever present like this? Do they have this kind of a presentation to the emergency department? PE, Tara's telling us. Definitely. I don't, preeclampsia, there we go. Yes. CHF in infants, absolutely. How about mental health? How about you people from mental health? Do your folks ever do this stuff? And I'm seeing, yep, anxiety, overdose, panic attack. Absolutely. So the moral of the story is, if I create this one nursing note and I build it for my heart failure patient, and I put it on a central repository location on our shared drive in our department, now my pediatric friends, my mental health colleagues, my OB people can simply say, okay, I got to build a next gen question case and I need some ideas. Oh, look, copy, paste, copy, paste, copy, paste. And I can use the same information and take it 15 different directions depending on how the rest of the questions fall out. So this is a great shortcut. Same with this list of vital signs we just saw. I can use this on lots of different patients. Same with this DHR list, or the lab report, diagnostic test. I can use it on other patients. Or I may pull this one from the repository and I'm like, yeah, but I wanted white blood cell count of 15,200. All I have to do is put a 1 in front of that, and I have created a completely different patient direction for that EHR. These 4, that's kind of like a standing order with every older adult patient rolling into the emergency department. I could take this scenario a lot of different directions. I can make the same copy paste with the items themselves. This was an item that we used for Alfredo, but who else could I use it for? This I used in Alfredo, who else could I use it for? And you can see how I can simply take these parts and pieces and migrate them into several different cases. I could even take this drop-down option 1. I've got 5 different diseases there, and my drop-down 2 correlates with those 5, so I could have 5 different cases using this question. The other thing that you want to think about as you're rolling out Hernandez, Mr. Hernandez here, and I have developed my highlight item, recognized cues, based upon my preliminary EHR. My brain is in acute kidney injury framework right now. I am really thinking acute kidney injury. So while I create a recognized cues as a highlight, I'm also going to build a recognized cues as a grid matrix. And I'm also going to build a recognized cues as a closed dropdown. And I'm also going to create recognized cues and extend a multiple response. Now that I've done that, I have 4 cases and not 1, which allows me to take the highlight item is going to be the case that we practice in the classroom. The grid matrix is going to be the one I place on a unit test. Closed dropdown is going to be the one that comes on the final exam. And the extended multiple response, I can rotate to next semester to use on a different test. So you can build multiple cases in one setting, and you just get more for your time that you're spending, because it doesn't take a lot more time to add different item style types when your brain is already into recognized cues for acute kidney injury. Wanted to highlight for you, this has been a great day. I hope you've been able to sit in on all of our sessions, but if not, I encourage you to go into our archive. These various webinars are available as part of this 4-topic series on testing. And now I would love to honor questions that anybody may have regarding the material we've talked about today, or even material we talked about in previous sessions. So I see that some of the questions have already been coming in, and I appreciate that. So let me just kind of work my way through those. Shelley asks, would you qualify how all the apply questions are graded on NextGen? So select all that apply questions on the NextGen exam is going to use the plus minus scoring. That means that if a student chooses a correct answer, they will receive a point. If they select an incorrect answer, they will lose a point. Okay, so if you've got a select all that apply that has 10 answer choices, 5 of those are correct. The student selects 4 out of the 5, they get plus 4. And then say they select 2 incorrect answers, they will get minus 2. So that student would get 2 out of 5 points for that particular set of question. What I encourage everyone to do, if you're not familiar with the NextGen scoring, go to National Council State Boards of Nursing website, look for their quarterly newsletters. I believe it was summer of 21 that they published the scoring guidelines for all the item styles. And you can find a very clear explanation of how each of these different item style types are scored. So thank you for that, Shelley. Next question I see from Bonnie says, do you recommend using evolving case studies used throughout the curriculum and or your program, building an EHR for a set of clients used through semester study and nursing program? You know, a lot of the research on that has been very successful. And what we find is that when students are already familiar with a patient in a case, they develop a camaraderie, a kinship, a sense of comfort because they already know that person. And certainly having those evolution of cases throughout your curriculum, I think can do nothing but make your students stronger. So that's a great pedagogy that many schools are using, and I wholeheartedly support it. I think students love it as well. So thank you for that. Christina, in the highlighting, would they be wrong if they highlighted glucose and blood pressure? And the answer to that is correct, is you are right. I mean, you highlight and get the point if you get it correct, but it would be incorrect if you didn't select the correct answer. So it would be a plus minus scoring if there were multiple highlights that were going to be taken from that particular test question. Jodine asks, any hints on dates? What if they are giving the same test on different days? What if we are giving the same test on different days? I guess I'm not real sure, Jodine. I'm not sure I understand what it is you're asking. Are you asking about dates on the EHRs? I don't know if you could type in some clarification. That would really be helpful for me. Pam is asking what percentage of NextGen questions will be on the NextGen NCLEX. So if you remember at the start of this session, I showed you a table that had minimum number of questions, maximum number of NextGen cases. If you take those percentiles and run the numbers on it, that means that a student getting the minimum length exam is going to have 25% of their exam will be cases, will be NextGen questions. Students that go to the maximum length exam, averaging about 7 questions between minimum and maximum, theirs is at approximately 17% of the exam is going to be NextGen. So the numbers that I've been going by and telling people is 25 to 17%, or 17 to 25, is how much the NextGen is going to be a portion of the new exam as they move forward. The rest will be traditional style items. Jennifer is asking if templates are available to help design a different style of questions. I'm pretty sure in your handouts that I had placed a template that we have designed here at NurseThink. If that is not in fact the case, I will have Sharon post that after this webinar, and you can go into that and you can download the templates that we have created that will help you to design the cases as you're developing them. Lab date, I see Jodine is now coming in to clarify lab dates note entries. So you're saying as far as developing the items, should we add dates to those? So what I typically do is I will give a month and day, but I will not put a year. And that way it stays current, no matter how many times you use that EHR, no matter how many times you use that lab data. So that's kind of how I worked it in the past, and I'm hoping that I'm answering the question that you have, Jodine. Okay, and I see here you said yes, dates on the EHR. So that is all the questions that I'm seeing. I think what I will do, I did get a chat from Sharon. She said yes, that the templates and the cue cards are a part of your handouts today. So thank you, Sharon, for that. And I would encourage you to go into those. You can copy paste those and use them however you choose to. So I appreciate so much everybody taking the time today, and I hope you have some great tidbits and takeaways that you'll be able to put into your classroom. Sharon is going to go ahead and come on and explain to you how to complete your evaluation for your contact hours. Thanks, everybody. Have a good day.
All right. Thank you so much, Karen, for your presentation. And yes, we will get any handouts that you have questions about. We can get those to you. I believe we're going to gather a couple extra handouts. If you do not have the cue cards or the templates in your handouts for the live viewers, we will go ahead and email those out to you, so you don't have to contact us. We'll just send those out to you this afternoon. And for our archive viewers, we'll have those added to your handouts on the right side of your screen. So now we invite everyone to fill out an evaluation, and that will produce your certificate with your contact hour. It also gives you an opportunity to ask any further questions, give us some feedback on the webinar. So for our live viewers, a new screen is going to appear in just one moment. Please click the continue button to proceed to the short survey that will produce your NCPD certificate. And for our archive viewers, please click that evaluation link on the right side of your screen. Thank you to everyone for joining us today.